You have ER doctors and hospitalists giving IV blood pressure medicine to people, okay, for elevated blood pressure related problems, right? I can tell you all the research shows when you give an IV blood pressure medicine, okay, you increase ischemic stroke, hemorrhagic stroke, and death. When you bring someone's blood pressure down acutely, you don't actually help them. And what you have to look at, the pressure. The pressure in the systemic body is different than the pressure in the brain. The brain has something called autoregulation. It autoregulates its own pressure up to a certain point. So up to that point, when they're given blood pressure medicine, they disrupt the autoregulation and can cause strokes and death that way, right? There is not a single study under the sun that exists that improves outcome by acutely lowering the blood pressure. So what I'll do to make everybody happy, to make the patient happy, to make the inpatient doctor happy, to make the lawyers happy, I'll give a PO dose. I'll give an oral dose of blood pressure medicine. It's kind of a game I play because I'm addressing the problem because everybody's brainwashed into thinking that actually you have to do it. But the oral medicine has not been shown to cause harm. Say 15 years ago, when I wasn't doing it, I would get a lot of pushback. In fact, I got called in the office. I was basically fired from a job related to not doing this. That was one of the things. I actually left. Wasn't really fired. I was being threatened basically. And because I didn't treat the blood pressure, and I said, there's no evidence. The evidence-based medicine tells us that there's no benefit. There's only harm. So back then, there was a lot of pushback. Nowadays, at least it's known well enough where it's accepted. And what I do actually now is I put some research articles in my note and some references showing that if I treat the blood pressure, again, the mean arterial has to be under, say, 140 for a non-hypertensive or under 160 for a hypertensive person. As long as they meet that criteria, which 98% of the patients are below those numbers when they're elevated blood pressure. Then I put the references in my note showing that this is why I'm not treating the blood pressure, because I'm not going to cause harm. So since I started doing that, and now that information is starting to come out a little bit more, I don't get any pushback. I get the primary care doctors that I send out, or the hospitalists, or whatever doctors are seeing what I'm doing, because in ER you're in a fishbowl. Everybody's looking to see what we're doing, and so I don't have any problems anymore. I can still practice medicine in a safe manner, and not cause harm and not get pushback. But that's a big one. This is one that all the doctors need to be, just like the vaccines. This is basically a scam of treating blood pressures in the ER in the hospital acutely. You know, how many times do I get a patient being sent to me by an ENT doctor, an ophthalmologist, a primary care doctor, a dentist? Like, I can go on and on. For the blood pressure so high, they send him to the ER. No symptoms, right? Why is the pressure high? Because their adrenaline is released because whether they're in pain, they're anxious, they're nervous, whatever the case is. This is the way God made our bodies. Everybody's blood pressure goes up and down. I said, now that I'm talking about this, because I've talked hundreds and hundreds of times to patients, my blood pressure is probably higher than yours right now. Okay, so we're not going to treat it acutely because we're going to cause harm. Because sometimes I pull up in the screen, I show them the research, because they're sent in by their primary care doctor because they think it's an emergency for their blood pressure, right? And I'm not gonna, because the only different thing I can do compared to what they can do is I can give an IV medicine, and they can't in the office. So I can bring it, I said I can bring it down like that if I wanted to, but I'm not gonna do that because that can cause a stroke.
Are other doctors like you secretly coming up with workarounds to avoid being sanctioned or penalized or fired for going outside of the quote-unquote standard of care to actually treat or save patients?
It seems like to me, I don't know anybody who's come up with this workaround. In fact, I've even presented this when I was in faculty at a medical school and teaching residents. I've actually talked about this in an amphitheater of over 100 people, and trying to give people tips of how to deal with this problem. Because we've talked about this. ER doctors, most ER doctors know this. Most well-trained ER doctors know what I'm saying, and they won't treat the blood pressure with IV medicine. Most internists in the hospital don't know it, and they'll give us a hard time. Why aren't we treating it? I don't know anybody who has a workaround. I've developed this myself, and I've shared it with people. I think it's a great way to do it, because that way I can accomplish not harming the patient.
You mentioned earlier something about not being able to get a code when you were entering a diagnosis.
Yeah.
What was that code called again?
The ICD-10 code. Okay. That is the diagnostic code. That's the database of all diagnoses around the world, actually. That is there so that they can track diagnoses and also for billing. It used to be we could make our own diagnosis up. And I think the problem there is that the billing companies didn't have that on their list. So now they have implemented this system where we can only pick from a list of diagnoses.
And those lists ultimately end up making some pretty big bank, don't they?
Right.
Yeah.
Yeah, I mean, healthcare is a big business, yeah, for sure. No question about that. And that's how they were able to implement the vaccines, right? They're incentivizing the doctors. It's all about money. And again, most of the doctors are just brainwashed. Okay, they're incentivized by money too. Are there doctors out there knowing what I know and still giving it and getting paid for it? I don't know. Like, I don't know any like that. Most doctors haven't looked at the research anyway, but I think that the doctors that I know that like, for example, with the COVID or awake for COVID, they wouldn't play in the sandbox. They wouldn't, like, I have a friend who's an ER doctor, very, very high moral guy. And he's a partner in the group. He basically, he never wore a mask. He never didn't get injected with that kill shot, and he was getting in trouble all the time, but he didn't care, and he made it through. It's surprising he made it through without getting fired. Actually, I mean, part is because he was a partner in the group, but why didn't the hospital demand to get fired? I don't know. He was probably very close to that.
I think we should start getting into the data.
Okay, Tom Linovic and Shaw in 2011, they published a study in the Journal of Inorganic Biochemistry. And what they did is they looked at the vaccine schedule and correlated and the aluminum content in the United States, and they correlated that with the outcomes of autism spectrum disorder. They also looked at 6 Western countries that also vaccinate, right? So the U.S. data is from, they got this, prior to the age of 6, in other words, those who were vaccinated, they got that from the CDC data. So 6 to 21 years old, to look at the outcome of autism, they took that data from the U.S. Department of Education annual reports to Congress in 1991 and 2008. So they were able to get this data, right? And then they also looked at the 6 countries they looked at: UK, Australia, Canada, Sweden, Finland, and Iceland, okay? At the beginning of the paper, before they give you they show you the data that they got, they go into this description of something called Asia. What Asia is, it's well-known, not controversial, chronic diseases caused by the aluminum in the adjuvants, the adjuvant aluminum in the vaccines, right? So it's called autoimmune inflammatory syndrome induced by adjuvants. The adjuvant is aluminum. That's what we talked about before. Aluminum is put in there to make it last longer. It's called the depot effect. If the vaccine lasts longer, theoretically it'll be more immunogenic and it'll work better, theoretically. But so they say, well, and they comment in the article, if this Asia is accepted in adults, why is it not accepted in kids? Because as we talked about before, babies have, we talked about blood-brain barrier and the development of the brain, and then also the doses are higher. So it's certainly plausible that this could be causing autism. They sort of just spell it out, and then they go into the research and show you the data. What they showed is there's a dose response, okay, between the micrograms of aluminum, cumulative exposure in these kids, in the U.S. data, compared to autism at 6 to 12 years old, right? So they definitely have a correlation of, the more mercury, the more aluminum in micrograms, the more likely they have autism spectrum disorder. They also looked at number of vaccines. They just looked how many vaccines did they get. They also showed the more vaccines, the more likelihood to have autism spectrum disorder. Again, this article is showing the same outcome as many other articles. This is not conspiracy. All these researchers are showing the same thing, right? So, and then they looked at the six Western countries, and what they looked at there is they looked at which ones introduced the vaccine earlier in life. In other words, how many countries introduced it first day of life, or up to 3 months, and how many of them started, like, say, at 4 months or 6 months, whatever. And they found the correlation that the countries that introduced the vaccine earlier have a higher likelihood of autism spectrum disorder in that country, in the prevalence in the country. So it's clear cut, by country, each country, they introduced it earlier on, more of an effect. Albert Beretti, 2021, published an article in the Journal of Trace Elements in Medicine and Biology. And he kind of looked at a lot of different information that's out there in the literature. This is more of a review article rather than an experiment. And what he looked at the published data that's out there showing more aluminum in vaccines correlates with more autism spectrum disorder. Some of the articles we've already shown you, I've already mentioned. He looked at all the mechanisms of how aluminum works in the body, all the published data on that, and it is able to prove in the article that aluminum is a neurotoxin, right? And he also looked at, he reported on this, the study I talked about with the other countries that are vaccinating more, and some other data. He showed that the countries that vaccinate have higher vaccination rates have higher cases of autism spectrum disorder. And they also looked at like the safe amounts, which I'll talk about a little bit later, but he says the safe amounts are based on diets in mice, okay, which is, he said basically it's inadequate safety amounts. So, if you think about it, if somebody's exposed to aluminum, very often you can have some damage to the brain, but you're not going to have an acute change in behavior, right? Unless you have a really, really high dose. So they're looking at mice, first of all. Is mice a human? No. And the other thing is they're looking at how well do they eat their diets. They are able to consume the same amount of food. So they give them so much aluminum, micrograms per kilogram of body weight. They alter their diet, that's considered the concentration that would be safe for a human being. And by the way, I also want to point out there's two concepts in toxicology. One is called stochastic, one's non-stochastic. In other words, one is probability and one is not probability. There's an effect. Like, for example, probability of radiation causing cancer, right? So there's an increased probability if you're exposed to more radiation, more likely to get cancer. That's just a probability. A person may be exposed for a long time and not get cancer, for example, right? Vice versa, it's a statistic. There's other things that are toxins that are not considered statistics. They're not probability, like mercury and aluminum. In other words, they are not compatible with human life. So even a little bit is not healthy. But we are given these guidelines of what is acceptable to be safe. But it's not up to probability. There's no safe amount. In fact, aluminum is a toxin to every living organism on Earth. So there's really no safe amount.
So why is it allowed to exist?
It's a good question, and there's an article I'm going to show you regarding. It's fascinating that it's put in feeding for neonates in neonatal ICU. It's put in it's called TPN, which is, well, we'll talk about that in a minute. So it's actually very interesting because why do they put aluminum in TPN? Interestingly, they pointed out in the article is that when in mercury that was in the vaccines in the 1990s that supposedly was taken out, but it really wasn't taken out, it was just reduced as they were increasing the vaccine schedule. I mean, by the way, just as an aside, when the parents were complaining to their congressmen that their kid got autism from the vaccine way back when, which caused them to alter the amount of mercury, they were noticing a sudden change because there was a lot of mercury in the vaccines, right? So what they did instead is they increased the number of vaccines and put a smaller amount of the mercury. So guess what? You're not going to notice it. You get the same effect, right? You're going to have it's a neurotoxin, but it's much more of a gradual change because they have increased number of vaccines, smaller amount. So the total amount of mercury, I don't know how it compares exactly, but it's probably very similar. When you have more vaccines and smaller amount, you just don't notice a sudden change.
So
think about that.
When they introduce these vaccines, just so that they can introduce this mercury?
If you look at the history of smallpox, which really did not eradicate smallpox, it wasn't the vaccine that did it. It was not the vaccine that did it. It was not the vaccine, smallpox vaccine. When you look at the corruption that occurred in the 1700s and 1800s of the vaccine industry then, it's quite clear that the vaccines are really intended to harm the population.
Yeah, because when you're telling me that parents were quote unquote complaining about their kids developing autism, and then as a result, what they do is they reduce the amount of harmful toxins, neurotoxins, and then just give more or
Right.
different vaccines that they're just arbitrarily introducing. That tells me that they're insistent that every child gets a certain amount of these neurotoxins into their
Right.
bodies.
So what this article points out, okay, is that when they decreased the mercury amount per vaccine, you know what they did? They increased the aluminum concentration in the vaccines too. So, and think about that. They're given for two different reasons. The mercury is put in as a preservative. The aluminum is put in there as an adjuvant. Completely different reasons. Why would they need to increase? This is what the article is saying. Why would they need to increase the aluminum? Because they're decreasing the mercury. Think about that. And that's why we're seeing the autism rates go skyrocket, basically, over the past few decades.
Is there a scientific justification for
No.
this?
None.
Is there a medical justification?
No. There's no medical justification. Again, the adjuvant theory, which we can talk about, it's just a theory. It's not really been proven. I've reviewed the literature, and I guarantee you that the vast majority of doctors who are giving out vaccines have not reviewed the literature on aluminum as an adjuvant. They've just really been given that reason and accepted it. It's not, there is no data showing improved outcomes. That antigen is more and more immunogenic, and the vaccine is going to work better because you put aluminum in it. But that's the theory. That's the theory. And then the mercury, all they have to do is make single dose vials and make it sterile, which they do to many drugs. You don't have to put mercury. Mercury is a preservative. If you have a multi-dose vial, fine, you need a preservative of some sort, right? Because they're going to be introducing potentially bacteria when they put the needle back in there, if it's not done correctly. But if they're single dose vials, you don't need any preservative anyway. So there was no reason to put mercury in the vaccines to begin with.
So if you were to ask a pharmaceutical rep or CEO, somebody that works or has an interest in big pharma, what would be their justification? What would be their reason if you said, why is there mercury in these shots?
Well, they'll tell you because it's a preservative. That's why. That's why they say it. That's why they'll say it. And
But you know that it's harmful.
well, they may convince themselves into thinking that, oh, it's just small amounts. It doesn't really matter. That'll be the only explanation for it.
But the explanation doesn't match the data.
Right. And that's the point. The point is that there's a lot of data already out. There's going to be more coming out, I think, very soon. But there's already a lot of data out showing harm. For real. There's no data showing safety. Any of the safety, there's a guy from Stanford who published he started an Excel spreadsheet that he enabled other researchers to, this happened last April. He put it out and he had other researchers to basically put in all these articles showing safety in vaccines, okay? So I have a copy of it. I was able to get this Excel spreadsheet. You can only add to it. There were 270 articles showing safety, right? First of all, half of the articles aren't even on the vaccine schedule, right? So it's like chlamydia, a vaccine for chlamydia, a vaccine for cholera, a vaccine for anthrax. They're not even on the vaccine schedule. So I didn't even look at the results. The ones that are actually on the vaccine schedule, they're looking at acute reactions. They're not looking at ADD, autism spectrum disorder. They're not looking at any of these outcomes. None of them. And it's stunning. It's amazing to me that they've all convinced themselves these are the safety studies. Well, the safety studies, you need to look at vaccinated versus unvaccinated, and you need to look at the outcome that matters, something that could be a permanent disability. Any of the articles that look at that, they all show harm. There's not a single one out there. And we talked about the Gardasil. That's the only one that they point to, that they say the safety, and I looked into it and we discussed it already, right? The Gardasil vaccine, that's not a safety study. Does not show safety. That's the only one that really exists that looks at significant outcomes. And in this case, the outcome would be major adverse reaction, which would result in hospitalization, something life-threatening or death.
And they say for this Gardasil that there was a safety study.
Yeah.
Was there, in fact, a safety study?
Well, it was done by the drug company with no external review. And the funny thing is they're reporting that it's not safe. That if you look at it, at least there's some level of honesty. In other words, they didn't make up data. They did report their findings, but the way they present the findings is deceptive. And there's no published data in PubMed on the Gardasil and safety of Gardasil. So Mawson and colleagues in 2017 published an article in the Journal of Translational Science, and this was a cross-sectional study. And what they did is they looked at surveys from homeschooled parents of homeschooled kids from four different states: Florida, Louisiana, Missouri, and Oregon. And they looked at these kids, 6 to 12 years old, asking the parents, have they had any of these diseases? There were about 666 kids, and the parents didn't know why they were being asked. But they would, in the survey, it was like, did they get vaccine or no vaccine, right? So they just answer the questions, and what they come up with odds ratios again, okay? So allergic rhinitis, 30. A 30 to 1 odds of getting allergic rhinitis, which is basically a allergic, nasal congestion, cough, whatever, that kind of stuff. 30 times more likely those who are vaccinated versus unvaccinated. Just general allergies, 3.9. ADHD, 4.2. Vaccinated versus unvaccinated. It's 4.2 to 1. The odds are 4.2 to 1 to get ADHD compared to the unvaccinated. Learning disabilities, 5.2. Any chronic condition, 2.4. Otitis media, which is a middle ear infection, you treat with antibiotics, 3.8. Pneumonia, 5.9. And neurodevelopmental disorders increased by 560% in preterm vaxxed patients. In this study, you find, chronic disease, right? Like allergies, that kind of stuff, right? Eczema. You find neurodevelopmental problems. We find acute infections, increased acute infections also in those who are vaccinated versus unvaccinated. Now, what they also did is there's an internal control in the study, which is nice, okay? The likelihood of them getting chickenpox, whooping cough, which is pertussis, which can be treated with an antibiotic, and rubella, okay, they have a lower likelihood in those who are vaccinated versus unvaccinated. Great. That's what we're after. We're after that lower likelihood of getting those, and we're willing to allow these other problems to happen. If you get rubella or whooping cough or chickenpox, right, it's a self-limited problem you get, and then you get over it, and then you go on with your life. If you get allergic rhinitis or allergies, that may be a lifelong problem.
Or ADHD or autism.
Yeah, absolutely. Those are bigger problems, right? Of course. Yeah, some severe autism spectrum disorder can be quite devastating. I mean, they're just taking all types. There are ones that, these kids like 24/7 need 24/7 care. They can't talk. They can't eat them.
Every single American knew this. Hey, the trade-off is your kid may get chickenpox or rubella, but there's a really good chance that your child will have autism or ADHD.
Yeah.
If 100% of Americans knew that, how many of them do you think would subject their kids to one of these shots?
0. And I think I'm very confident. It's going to take some time, but I'm very confident we're going to get there. I'm very confident we're going to get there. I think this is getting exposed. And that's what we're doing right now. So Hooker and Miller published a paper in 2020 in the journal Sage. And this was a retrospective cohort from 2005 to 2015. They looked at data from 3 pediatric practices. They looked at over 1,500 records. And they calculated odds ratios of vaccinated versus unvaccinated in these outcomes. And they defined vaccination up to the age of 1. And the outcomes were over 3 years of age, 3 years, 5 years. And they found the odds ratio of developmental delay greater than 2. I mean, in other words, a 2 to 1 ratio of vaccine versus unvaccinated having a diagnosis of developmental delay. Asthma, 4.5. More likely in the vaccinated. Ear infections, 2 to 2.5. And I give the range because they looked at 3 years and 5 years. And they did a control. They did head injury control. And they found no association of head injury with vaccines. So in other words, it's not it's not just coming to the doctor and getting the diagnosis necessarily. It's there's no association with head injury and vaccines, right? But there is an association of vaccines with these other outcomes. And they also looked at up to a certain age of getting vaccinated. So in other words, they looked at developmental delay and vaccinated up to the age of 6 months, 12 months, 18 months, and 24 months. So if they've been vaccinated up to that point, then they look at these outcomes later at the age of over 3 years of age. And if they were vaccinated up to 6 months, they get 95% chance of increase developmental delay by 95%. If they were vaccinated up to 12 months, they found 118% increase risk of developmental delay. If they were vaccinated up to the age of 18 months, 192% increased risk of developmental delay. And if they've been vaccinated up to 24 months, 251% likelihood of a developmental delay diagnosis in the vaccinated. So that's another.
You mentioned a lot of things. You've mentioned ADHD, you've mentioned eczema, you've mentioned chronic allergies. Is it safe to say that all of these conditions are actually vaccine injuries?
There's no question that the increased risk of these diseases is caused by the vaccines. Is it the only thing? There's poisons in the foods. There may be other toxins out there that they may be exposed to that may be contributing. But if I were to, an educated guess based on my look at the literature, I think that the vaccines are probably the biggest contributor. That's what I think.
What else could cause eczema or chronic allergies or peanut allergies or ADHD or autism in a 6-year-old or an 8-year-old?
Well, all the poisons in the foods, what natural flavors is in food? The FDA does not have any responsibility to check what natural flavors is. So it's a blank check. And if you if you go to the supermarket and you go to all these packaged foods, you'll find natural flavors in nearly everything. I haven't found a single sports bar without natural flavors. Okay, or seed oils. So the seed oils also is a problem, right? Seed oils is derived from petroleum, from crude oil. There's a website you can go to if you want to open up a company to make either whether it's soybean oil, palm oil, canola oil, vegetable oil. You pick your oil, and you pick your country where you want to open up the company, when you want to set it up. You go to the website and you click what you want to do, and you pay the money, and you can have a whole process of these seed oils. And every single one of them, if you look back with the processing, the entire process, it starts with crude oil. We were not designed to be eating crude oil. So, and they just refine it for human consumption. But that's another problem. So, there's a lot we can talk about regarding foods, but I think that I think that the vaccines is the biggest problem. As I said, regarding the aluminum, it's aluminum being in fact, there's aluminum in food. There's aluminum in baby formula.
I guess what I'm asking is it possible that a child is just born with eczema or a peanut allergy or ADHD?
That's this Henry Ford study, okay, in Michigan. That's really what it's telling us, that many of these diseases don't exist. I'm not saying that it never exists, but it's so unlikely for a child to develop these chronic problems if there's no toxins going into the child. It's extremely, I never say never. Is it never? Probably not. There's probably cases that are, genetic, but we assume that they're all, a genetic related problem, inevitable. There's nothing we can do. We don't know what the reason is.